Hi, thanks for watching. Okay, so in this video, I would like to talk about Dr. Michael McKee. Okay, this is the vascular surgeon who's been accused fairly credibly of killing Monique and Spencer Tepe on the 30th of December. And very similar to the Barry Morphew case, okay, there is so much corroborating evidence. I mean, different corroborating evidence involving the weapon, involving just the whereabouts of how Dr. Michael McKee was actually located. And he actually drove in his own car from Illinois to Ohio. And there's just so many things that triangulate him around the scene and around, the fact of the murder that, kind of like Barry Morphew, it's one of these cases where even though we don't have a conviction yet, you know, obviously the government has to treat him as an innocent person, right? But we as the people, I mean, we can look at the evidence and the presumption of innocence from the Fifth Amendment of the US Constitution. I mean, that applies to the US government and it applies to, like, say, the judiciary. In other words, the government and the judiciary have to treat people as innocent. But we as the public, for example, like say with the OJ Simpson, before and after his not guilty verdict in the OJ Simpson case, everybody knew that there was overwhelming evidence that that guy was guilty. Just like with Barry Morphew, any reasonable person knows that Barry Morphew is he's cooked. I mean, the evidence is overwhelming, and I think the same is in this case. So, yeah, I mean, the courts have to treat these people as innocent until they get a verdict, but we as the people, we're allowed to have our thoughts. And the US Constitution doesn't invade our thoughts. And in some cases where the evidence is overwhelming, it's okay for people just to think privately that someone is guilty because it does look that way. The courts, on the other hand, they'll need to take a little more time to formally establish guilt, let's say, in a legal sense, in a judicial sense, right? So while I do have some questions around this case, for example, I would like to know, how did Michael McKee get into the house without actually forcing his entry into the house? Okay, so I am concerned about, maybe he figured out a way to sort of spy on them as they were coming in and out of the house, and maybe he used like a Zoom camera to like figure out like what numbers they were pressing on the code, like say to unlock the code of the door, if there was like a keypad code or something. So I'm curious about those little details, and maybe, I don't know, maybe I'm kind of curious, like, was there some catalyst that like provoked him, or was he always planning this for like a long time, or was he going into, like, say, a depression, like a personal depression or a professional crisis, where he felt like he was becoming almost like, say, suicidal in a sense? And so he was gonna, if he was gonna go down, he was gonna take other people down. Like, I'd like to understand maybe some of the dominoes that sort of led to, let's say, the catalyst that led to him actually wanting to commit this crime. So yeah, I have a few questions, but I don't have questions as to whether he's guilty. I mean, personally, I'm not really, that's not really interesting to me. But I do think this case is very interesting psychologically, because I think right now, I think people are painting like an oversimplified picture, and maybe almost kind of like they're sort of making a caricature of Michael McKee. And I think they're saying like, oh, he's an arrogant person, he's a sadistic person, he's a monster, he's a psychopath. I think that might be just a little too simplistic, And I think in this case, I think it might help to kind of maybe just take a cooler, more neutral look at this case, because I think this case actually has a lot to teach us about overachieving, like people who are overachievers, and a special kind of narcissism that arises with overachievers. And I think this case is so interesting, from this angle of the overachiever, that it might allow us to almost kind of rethink how we conceive of narcissism. I mean, how we think of narcissism. So this case, I think, and maybe it's not like the biggest riddle as to the who done it. I don't think so. But I think it allows us, I think, an angle on narcissism. And it doesn't even require that Michael McKee actually have narcissistic personality disorder. Okay, it's enough that he just have certain narcissistic issues. Okay, without necessarily qualifying for the full disorder. It still has a lot, I think, to teach us about the nature of narcissism and what narcissism really is. And so this case, I think, is very important. And this case hits very close to me for various reasons. Okay, one of which, I myself was diagnosed with a personality disorder when I was 18 years old. Okay, that's been a long time ago, but I myself was diagnosed with NPD. Okay, that quite a while ago. I don't think my NPD is anything like Dr. Michael McKee, because I personally think Dr. Michael McKee has obsessive compulsive personality disorder. So whatever narcissism he has is a more sadistic, disciplinarian kind of narcissism, or he has just like he has a different flavor of narcissism. So I don't personally relate to him, but I personally relate to this case because both of my parents are doctors. Okay, so I hear all the people talking like on the internet right now, and everybody's responding to this. Oh my God, how could a surgeon, such a smart, intelligent guy, so smart and intelligent? Yeah, I understand. Doctors are very smart and intelligent. I grew up with doctors. Both my parents are doctors. I grew up around all their friends, all their colleagues. They were like close to our family. So I've been around doctors my whole life. And yes, I do think of doctors as being intelligent, but to be honest with you guys, when I really think of doctors from my own personal experience, I think of doctors as being more emotional than intelligent. They are intellectual, but they're not pure intellectuals. Doctors are like they're powerful people. Okay. To get through medical school or to even get through college with enough success that you can actually go to medical school, and to actually get through medical school and then to get through a residency, you need to be a furnace powerhouse of energy. Okay. And human energy is inherently is emotional, right? So really, to me, doctors are just furnaces of emotional power. Now a typical doctor will have a lot of control over their emotional furnace, but whenever a doctor gets into a personal crisis, and I have witnessed this in my own life, I've seen both of my parents in crisis at times, you know I can attest that doctors, when they get, like, say, things go wrong in their lives and they get into a crisis place, that furnace of emotional intensity really shows up. Okay. And so it can be very dramatic. And I've seen this in many different ways. When I was working in a law firm, I once represented did I represent? I can't remember whose side of the case I was on. I was on a case that involved a neurosurgeon who got in a lot of trouble. Okay. I think I was on the other side of this case. I think I was on the side of someone else in the case, but it involved a neurosurgeon who had a lot of personal problems. Okay. And this guy was super intelligent, but he was also very emotional and he was also very powerful. Okay. But this neurosurgeon, he ended up punching a physician's assistant in the face. And it was complicated because the physician assistant, I think, was homosexual. And there was some issue as to whether he was hitting on this neurosurgeon. So it was a very complicated case. But I can just tell you that if you knew all the details, as we really investigated this neurosurgeon, I mean, you could just see, this guy was just a package of emotions. So I am not really, I guess I see it from a different angle. Like, all these people are mystified. Oh, this guy's so intelligent, he's such an intelligent guy. But if you really know doctors, they have intelligence, but to really be powerful enough to get through a medical school and a residency, you have to be a heavy duty bulldog of emotion. But on top of being big furnaces of emotion, the other thing that makes doctors special is that they are overachievers. Okay. And overachievers, this is a very special category. And I think if we can learn to better understand what it means to be an overachiever and the significance of the category of the overachiever, I think that will help us understand narcissism way better. And it'll give us much better insight into what exactly is narcissism. So to me, this is very fascinating. Okay, so I think at this point, I think most of us know when we see narcissism, we know it when we see it. I think most of us know what narcissism looks like. Okay, it's kind of like if you see a rash, I know that rash. That looks like chickenpox, right? So to see the rash of a chickenpox, okay, that's good. You see chickenpox, right? We know narcissism when we see it, right? But do we really understand the psychology that leads to narcissism, the psychology that creates narcissism? Okay, I think we have kind of like an oversimplified and maybe a naive sense of what causes narcissism. I personally think that. Now, everybody can disagree with me, but in my opinion, I don't think we really have our finger on exactly what is narcissism. I think we say things like, oh, well, they're insecure, they're immature, they have insecurity about self-esteem. But honestly, I think we could go a little deeper. And I think there are some things that at least I've noticed about narcissism that I think might help explain maybe just a little better what really is narcissism. And I think the overachiever angle or the overachieving angle, okay, this will really help us, I think, see this part. Okay, so for me, I do see different things that sort of contribute to narcissism. So to me, narcissism is not just one thing; it's like multi-factor, right? But one of the most important factors that I think adds to, like, say, the recipe for narcissism has to do with gratification. Gratification. Okay, so in that sense, I see narcissism, at least in the same family, or not too far away from like the world of addictions, right? And in fact, I think there are a few personality disorders that I think are not too far from addictions. So to me, I feel sad that addictions aren't considered part of the cluster B personality disorders, but that's my personal thing. But anyway, in any case, I do think that there's an issue with gratification that I think is part of the recipe that creates narcissism. Okay, so in my opinion, people who are narcissistic, in addition to other issues, okay, they have this issue of really being very sensitive to always having a lot of gratification. And I think part of what makes a narcissist is that you kind of get habituated, like an addict. You get habituated to getting a lot of gratification hits and seeking a lot of gratification reinforcement constantly. And it becomes sort of like you get used to it, you get accustomed to it, right? And unfortunately, some people through their experience, maybe because they're so successful or so talented, they're always getting a lot of gratification hits. Okay. Just imagine, like, say, in the world of YouTube or like the world of TikTok. Okay. If you are like an extremely good looking person, okay, regardless of your talent, regardless of whether you have anything really valuable to say, but if you're just extremely good looking, you're going to get a lot of hits on your channel, basically. Or like, say, if you're just in a social life, you may not be the most intelligent person, you may not be good at speaking, but if you're really, really beautiful, you're going to get a lot of gratification hits, a lot of attention, like, say, in a social setting, right? And so let's say, in the case of an overachiever, if you're a person who's just phenomenally not only smart but very good at getting good grades and kind of knowing what teachers want, getting a good grade in a class is not always being intelligent. It's also kind of knowing what the teacher wants you to say, kind of knowing how the teacher sees things, so that you'll come across good for the teacher. So it's more than just being smart. But if you have that uncanny instinct, maybe also call it a competitive instinct, right? Where you just know how to win. You always know how to come across the best for every teacher you've got in every class, and you're always getting very good grades, and you're always getting awards, and you're constantly being, congratulated, and you get a good high SAT score, you get a scholarship to a university. You're always getting these gratification hits. Okay. It's very similar to being a very good looking person. And so, in that regard, an overachiever is not just an intelligent person. Okay. Let's be very clear. To be an overachiever is not enough to be intelligent. You also have to have an uncanny sense of how to get gratification, or if you don't have a sense for getting a gratification, you have to have some super talent that just gets you gratification all the time. So it's either something uncanny that you do, like some competitive streak that you have, or it's some just innate talent that just brings gratification to you all the time. So when you have an overachiever, okay, it's more than just being intelligent. Being intelligent is not enough. You have to have some kind of talent or some uncanny knack for getting a lot of gratification all the time. Okay, so that is the special package of an overachiever. And I think also overachievers, they have a lot of energy, because it takes a lot of energy to always, in this competitive world that we live in, to always be getting like the highest accolades, the highest praise, the highest awards, recognition, being acknowledged for being more than just successful, but being, like, say, extraordinarily successful. It's sort of like the difference between being very good and being like outstanding. Outstanding. So to me, an overachiever kind of has that uncanny ability to always be seen as outstanding. But the problem for an overachiever is it's kind of like a drug addiction, in the sense that whether they realize it or not, they've gotten themselves habituated to a very high dose, a very, very high dose of gratification every day, every day, every day. And they're always successful, always successful. So an overachiever, whether they were trying to do this or not, they've actually got themselves set to a very, very high dose of something that probably hits the dopamine it probably hits dopamine. It's probably this constant gratification. And it's probably very similar to somebody who's used to getting like a high dose of caffeine or a high dose of maybe cocaine or something. And over time, you sort of get used to that dose. Okay. And so if you fall from that dose, from that level of dopamine reinforcement, you might run into maybe what you might think of as a withdrawal symptom. If for some reason that you stop having that constant rhythm of constant gratification. So whenever that gratification for whatever reason takes a slump and you're not used to it, it's going to be just as shocking as somebody who's used to taking a lot of caffeine and suddenly they got no coffee. Okay, it really messes with them, right? So that's one component of narcissism that I don't hear enough people talking about, which is the gratification, right? The gratification. The other part of narcissism that I don't hear enough people talking about, everybody talks about narcissism as having to do with self-esteem. And I think that misses the mark. I think what really is at play in narcissism is a preoccupation with status. Okay. Self-esteem and status are very close, but status really is, I think, a better way of describing what is really at the heart of what makes narcissism. Okay. Now, when I say status, I'm not just talking about, like, say, being famous or being high class or whatever. Status, just, you could think of status as meaning having a very comfortable standing in the world, right? And you might think of it as kind of like the hallmark of insecurity, that someone is so preoccupied with having a good standing in the world. Like it sounds like insecurity, but I think for narcissists, I think it can come from insecurity. What is my standing in the world? What is my status in the world, right? But I think it could also come from an innate competitive streak, right? And I think some people just have an innate competitive streak. So I think the best way to describe narcissism for me is that it doesn't matter whether it comes from insecurity or if it just comes from natural competitiveness. Either way, it could come from insecurity or just competitiveness. But whether by competitiveness or insecurity, you have too much of a preoccupation with your standing in the world, okay, with your status in the world. So that is the other element that I think, combined with the gratification fixation or the high set point of gratification. And then secondly, somehow that combines with like an excessive preoccupation. You're just consumed with a preoccupation, or maybe you don't even realize you're consumed. You're just living it, but kind of like the fish lives in the bowl, that they don't realize that they live in the water, that they swim in. But maybe somebody who's just so habituated to having a very good status, right? They're already, whether they chose it or not, that's their set point, right? So that if for some reason any question of their status arises, or they have a crisis where their status in the world is threatened, okay, it's going to show up almost like a withdrawal symptom, right? Where suddenly you don't have that constant reinforcement of your status in the world. So regardless of whether we really want to buy into this withdrawal analogy, this analogy to, like, say, the drug user's withdrawal symptoms, okay, either way, to really have something like narcissism, okay, you have to have some real issue dealing with anything that frustrates a person, okay, any kind of frustration in the area of gratification or status right? So whenever you run into, like, say, some kind of frustration, okay, where maybe it's either taken away or there's some complication, or somebody's creating, like, say, ambiguity as to, whether you're really getting gratification or whether you really have the kind of standing or status that is comfortable for you, okay, that's going to create a problem, I think. I don't think you can really be narcissistic if you don't really have a problem with having something interfered with or frustrated in terms of your gratification or your status in the world. So to really get to narcissism, you really have to maybe test it by seeing what happens when, like, say, in day-to-day life, something comes and frustrates your gratification, or maybe causes the opposite of gratification or takes it away. Or when something, like, say, when you have any kind of crisis with, like, say, any question about your status or your standing, okay? And that, I think, is where we start to create narcissism, okay? And this is especially true with overachievers, because when you're always overachieving and always getting constant reinforcement of both gratification and standing, okay, at some point, it's almost like you're never really tested in terms of frustration. All right. If you're the typical super overachiever, maybe by the time you're like 40 years old, maybe you've never had a real crisis in terms of your standing or in terms of getting a lot of gratification. And so what this means, unfortunately, this is unfortunate, okay? If you have, like, say, 100 overachievers, all right, if you're going to try to figure out who are the 5 or 10 among these 100 overachievers that may have what we might call overachiever narcissism, okay, let's call it overachiever narcissism, right? Let's say it's 5 out of 100. I'm just spitballing a number, right? So it may be that you'll never know out of 100, you'll never really know who are those 5 that might actually have some kind of narcissistic issue, right? They might be kind of like a narcissistic overachiever, right? Or an overachieving narcissist. You'll never really know who those people are, maybe until they're about 40, like 38, 40, 42 years old. Okay. It may take that much time for there to be really something that really frustrates their gratification or their standing in the world enough that you would even be able to tell if they have a narcissistic problem or a problem with narcissism. And this problem is really specific to overachievers. And they could be like athletes, they could be like actors, musicians, or, any kind of overachiever. But this problem is very specific to overachievers, okay? Because when you do not have an overachiever, all right, there are too many ways that a person can be threatened in terms of their status or their gratification that it shows up when they're much younger. Okay, so even when they're teenagers or when they're in college, you start to see problems right away, just with relationships, social problems and stuff like that. The problem is with an overachiever, and this is very important, okay? When you have someone who's a super overachiever, okay, they're getting so much gratification just from their success, like say in academics or in their profession, like say a young doctor, right? That they may actually be able to go a long, long time without having any real issues in their romantic life. Okay. Normally, for normal people, romantic issues, start when you're like a teenager, like you're having trouble dating girls in high school. But see, if you're a super overachiever, you're getting so much dopamine from all your success and accolades just in your academic success, that it might give you enough dopamine that you're okay. It may hurt, but you're okay that you're not like dating lots of girls. It's just a possibility. So, like, say, take a guy like Michael McKee, Dr. Michael McKee. Okay, he was like a national merit scholar. He was like, he went to school on a scholarship. He was super successful with his undergrad, very, very competitive. He was probably getting enough dopamine that if he wasn't like dating a lot of girls, like maybe dating a little bit, but if he wasn't dating a lot, it probably wasn't really affecting his ego that much because he was getting a lot of dopamine just from his academic and professional success. Okay, so this is why it's very specific to overachievers, because an overachiever can be so successful and have so much dopamine that they may be dating a little bit, they may have a few relationships, but they're getting so much dopamine from their professional life that you really don't see it. You really don't. Let's say a problem, like say some kind of issue with, like say, dating is not really going to show up until much later in life. Okay, so why overachievers are kind of a special case. Okay, so in this case of Dr. Michael McKee, okay, eventually there came a romantic problem, but I think it came a little later because I think earlier in life he was just getting too much dopamine, just from being so successful. But eventually, like everybody, every normal person, you're going to want to have, maybe a wife, maybe you fantasize about having a family. And since you're already habituated to having very high status, just by your professional success, you expect your family and your wife and maybe potentially your kids and your home life, your family life, to sort of match the status that you're used to, let's say, from your professional life, right? So probably it just was just natural for Michael McKee to think, well, eventually when I get my wife, I have expectations that, unconscious expectations that the status and the standing of my family is going to be about the same as the status and standing that I'm used to getting from my professional accolades and my professional acknowledgments, people that acknowledge me for my professional success. Okay, so this is, I think, where the problem starts. But it it could be that, like, say, for a really successful person that's sort of an overachiever, they may be able to get all the way to their late 30s before this really becomes a crisis. And I think it's only from this angle that we can understand how delicate it is, how delicate an issue it really is for an overachiever, let's say an academic professional overachiever, okay, let's say somebody who's getting into their 30s, they don't have a lot of experience dating, or if they have been dating, it's only been very superficial because they've been so invested in their profession, right? So it's a very special issue when you have a guy who's, like, say, in his early 30s, who doesn't have a lot of substantial experience with women, with dating, and then suddenly he needs to have a marriage. He expects to have a marriage that meets his expectations for the kind of status that he's achieving in his professional life. All right. Now, let's emphasize this. This is a guy that does not have a lot of experience with dating in a deep way, relating to people in a deep way. Okay. He's been focused on this professional success. So even if he's not a narcissist, okay, either way, if you have a professional who doesn't have a lot of experience dating, but they're very successful, it's going to be very critical how they approach, like, say, finding a wife, because they're not really seasoned in how to get along with women, in an intimate manner. Okay. And this is leaving aside the question of whether Michael McKee, because he was adopted, or, whether the issue of being an adopted kid, let's leave that aside. It applies to anybody who's been too much invested in their career. Okay. Who's too career oriented, who's so much of an overachiever, okay, that they really don't have a broad life experience. Okay. If you're already in your 30s and you don't have experience with women or having romantic relationships, it's going to be very critical, that first one or two relationships, because you're not seasoned for really relating to people in that intimate way. Okay. So that's very delicate, regardless of whether you're narcissistic. So in this sense, I think we can appreciate, okay, that when Michael McKee met Monique Sabatursky, okay, her name was Monique Sabatursky. Let's talk about her name as she was at the time. When Michael McKee met Monique Sabatursky, okay, in effect, despite being over mature, let's say professionally, like super mature professionally, at the same time, Michael McKee was very immature interpersonally in terms of like dating and relating to women. Okay. So he was like a super mature guy in terms of his profession, but in a sense, he was really, really strikingly immature in the world of, like, say, relating to women. So when Michael McKee met Monique Sabatursky, he was really very immature for that. Okay. In that area, not professionally, but interpersonally, he was a very immature guy. Okay. And I think this is important because I have a question as to whether Monique Sabatursky also, in her own way, was also kind of a spoiled, immature person. Not maybe because she was an overachiever, but maybe for other reasons. Okay, maybe if those who know Monique better, maybe they'll know that maybe she was spoiled. Maybe her father loved her too much. And maybe she was used to always getting her way, and she had kind of a way of always being kind of doted on and sort of indulged all the time. Like, I don't know, but I kind of wonder about that, right? So not that that's a bad thing, okay, if you have a man who's mature enough to accommodate that, right? But the problem is, if you have a man that doesn't have maturity, even to begin, like, say, the basics of dating 101, okay, if you have somebody who's super immature, he may not be ready to accommodate, let's say, the immaturities in the woman that he's attaching to, right? So that's the problem with when someone's immature. They're so stuck in their own immaturities, they can't possibly accommodate the immaturities in the other person. So my concern here is that when Michael McKee came together with Monique Sabatursky the first time, when they were just meeting, okay, my concern is that we may have had a story of two immature people coming together. Okay, Monique with her own immaturities of her own sort, maybe not the same as Michael McKee, but Michael McKee with his own brand of immaturities, and these two immaturities coming together. I would at least want to rule that out. Generally, it's not true that people always have the same problems. Like, say, if you accidentally get in a relationship with a narcissist, that doesn't mean that you're narcissistic, but you would also have to have some of your own issues, maturity issues, to even bond with a narcissist. Okay, because no matter how charming a narcissist is, I think a really truly healthy person would not feel comfortable bonding with that person. I think you have to have your own immaturity to bond with somebody who has their own immature issues. And I think this point about bonding is very important here, because a lot of people think that because the marriage that Michael McKee had to Monique, because the marriage only lasted 7 months, I think people think, oh, well, they never bonded. people are forgetting they were together before they were married, right? They were together long enough to make a decision to get married. Okay. And I think the problems only started for them when they moved to Virginia. Okay, remember, it was only when they moved to Virginia because Michael had to start his general surgery residency. Remember? Okay, so it's only when Michael started his residency that I think they started having real issues. Okay, now this is important. Okay, a general surgery residency is traumatic. Okay, whoever is going into a general surgery residency, they're not going to have any free time. So you already have to question the wisdom of even wanting to get married at that point. That must have been, very, very stressful. But the problem we're having is that they did bond before they started having problems. Okay, and the problems came. You could say, well, it's only because Michael is a crazy person, or you could say it only came when they got put under the pressure of having a husband in a general surgery residency, which would bring out the worst in everybody, right? So let's go back before they got married. Okay, they got bonded before they got married, right? Or at least they were bonded enough to even want to think about getting married. Okay, so if that's true, then my concern is that because Michael McKee was himself immature at that time and probably still is immature in that area in terms of like relating to women, right? Because he was immature at that time, I would be concerned about whether Monique in her own way was also immature. Okay, so let's then analyze a little bit about Monique's background. Let's say from the point of view of one of her good friends. And then also let's take a look at the video from the wedding just to see if we can get any clues about Monique.
I didn't even know his name. She never said Michael. She said my ex. She said he was bad. She said abusive. I don't think I ever got the impression that she was afraid of him. I got the impression that she hated him.
Okay, right away, I'm noting that this is her friend Gina, I think is her name. Her friend seems to be kind of emotional and not super objective, kind of more emotional than objective. That's just an interesting thing to note. She does seem to care a lot. She seems biased. But it's interesting how she said that she didn't get the impression that Monique was afraid of Michael McKee. That's a very important data point. Okay. I realize there's another relative that does make it sound like maybe she was afraid, that maybe he had threatened her with death. Let's table that for a second, because I don't feel like we're getting like super objective testimony from people on her side. But not to say they don't have good points. I'm just saying they're probably so traumatized by her being killed that you can't ask them to be neutral or objective. But as I listen to this person, what is important to me is that she is saying that she never got the impression that Monique felt scared of Michael McKee, but that she got more the impression that Monique that she hated Michael McKee. Okay, that's important. Okay. Now, if in my life, if I run into someone who really hates somebody, okay, my first feeling, even if they're close to me, even if those people are close to me, I'm going to have a little asterisk on that maybe if you're just in a raw state of hate towards somebody, okay, that tells me possibly that they haven't taken steps to come to peace with their problems with that person. Okay, so for example, like I've got ex-wives, I have people that I've had real bad past with, but I feel like I've gotten over the hatred, if I ever had that, you know what I mean? So I guess my first concern is I'm concerned that maybe Monique, I'm concerned that maybe she has maturity issues that didn't allow her to get over the hatred, or at least put into perspective and maybe, somehow kind of close that chapter in her life. Now, I do understand that maybe Michael himself made that difficult. So let's also leave that on the table. Maybe Michael sort of remained, let's say Michael remained in her life in some way, sort of maybe bothering her, or maybe in a way kind of stalking her. So let's leave on the table that maybe Mike may have not allowed Monique to, let's say, come to peace with what had happened. But either way, even if Michael was even stalking her, to just say that the only feeling she got was that she hated him, that just seems to me like a kind of a polarized way of looking at Michael. And so I am also a little concerned about the maturity level of Monique. Okay, so let's listen a little more.
And that she knew things were bad there, and I don't think it ever fully left her mind. I don't think anyone thought that this was going to happen. I also don't think that she ever thought he would leave her alone for the rest of her life.
Okay, as a person who myself, because I work in the legal field, okay, it's very frustrating to hear somebody speaking conclusory terms. By conclusory, she says she got the impression that Monique felt that Michael McKee would never leave her alone for the rest of her life. Okay, but she just concludes that. Tell me what Monique said. I want to know what Monique said exactly. Take me back to conversations with Monique. Okay, don't just conclude for me. Let me hear her talk. So recall for me, try to remember back to a conversation you had with Monique. Tell me what she said, how she said it, so I can also see why you're getting that conclusion. Okay, so it's always frustrating when people are very conclusory and summarizing, as opposed to just showing what Monique said, so that I can see, try to get a feel myself. But she just tells us how Gina, feels about what Monique said. So that's a little frustrating, but I get the idea that for sure it sounds like Monique had not really processed fully to, like, say, put in like a wisdom perspective whatever was going on with Michael. And I kind of wonder if maybe even after the divorce, if maybe, like, say, on a spiritual level, let's say the two souls, let's say the soul of Michael McKee and the soul of Monique, if they were, like, say, two egos still at war even after the divorce, like it was still just two egos, that hadn't resolved. Let's leave it like that. So that's going to be my concern. And so with that question in mind, let's look at the footage from the wedding, from Monique's wedding to Spencer.
Spencer, what can I say? From day one, I knew you were something special. I had quite a journey to get to you, countless bad bumble dates, wrong relationships, and waterfalls of tears. But it was worth every cringing second because it led me to you.
Okay, I'm going to be honest here. Okay, if I were Spencer, now I might not be offended. I might not be offended by it, but I wouldn't really like hearing what she's saying. Okay, now granted, I would respect that she's had a lot of problems and she's had every cringing second. It sounds kind of dramatic. I mean, honestly, it does sound kind of dramatic. I would respect it. Okay, but that's not how I would want a woman talking at my wedding. Okay, now granted, I might not be offended if I'm committed to her and I really want to be her husband. I might just be okay with it, but I might not also. Something is not right about a woman who, at a wedding to this guy Spencer, is going to devote all this energy to talking about people in her past and how she feels so terrible in every cringing second. That's her drama, and she wants to bring that into her wedding to Spencer. So yeah, I'll be honest. I mean, I something that to me is a red flag. Not that Monique is a terrible person, because if you have the right mature husband who knows how to take care of her, okay, that's okay. But I do think that Monique has some, I think, narcissistic, self-involved maturity issues. Absolutely. There's no doubt, because a person who has like a more modest sense of their own self and their own ego, they're going to be too respectful of their husband to bring all that drama into their wedding vows, I think. Okay, that's just my opinion.
Throughout all of this, I knew that God was guiding me to my person and that when I met him, it would be the most magical thing ever.
Okay, in all honesty, okay, what we're hearing is not very much about Spencer. We're hearing about Monique and her journey, her quest, her life story, and that Spencer shows up in her life story, and it's the best ever. You know what I mean? So yeah, that's kind of self-involved, and also emotionally. I'm sorry. Yeah, I understand she's getting married. Of course, I mean, I understand that. But yeah, I think we can all say that, compared to all the hundreds of people we've known in our lives, to kind of rate this on a scale, I'd say Monique seems to be kind of emotionally precious, a little immature, and very self-involved. And I think that probably this is actually a testament to Spencer, because Spencer probably decided he loves her because he loves her for who she is, and he probably is a good husband for that. He's okay with that, and I think with the right husband, you can be like that. Not every man in the world is going to want that. Okay, but for the right man who really loves her, and probably all she needs is just a little bit of indulgence. She's probably been spoiled. Her father probably loved her to death. That's what I'm thinking. And so she's probably kind of a precious girl. And so if you're the right kind of husband who can love a woman who's been, doted on by their father their whole lives. And if you're that kind of man, it's probably okay. I'm not saying it's pathological, but I am saying she is kind of on the immature side. So that's an important data point, because as we go back to when Michael McKee paired up with her way back when, we may have very well been looking at two immature people coming together. Two people also with immature egos, okay? Each in their different ways narcissistic, right? Where they're used to having a very high level of gratification and status. Maybe on the Monique side, maybe my theory is that her father probably loved her to death. That's what I'm thinking. She was probably very spoiled by her father. Probably her father probably just loved her to death. And then Michael McKee, very, very heavy on the gratification set point because of all of his accolades and success in his professional world. So, and basically a story, I think, of maybe two immature people coming together and clashing. Okay, whereas I think Monique eventually found Spencer, who was maybe a more gracious, mature guy who could maybe accommodate her and make it work. Okay, but the important part of this wedding is that we're getting evidence, I think, of who Monique really was and why it makes sense that they had problems when she was with Michael McKee. But anyway, let's keep looking at the wedding to see if she actually says anything specifically about Spencer and not just from her point of view. Let's see what more she has to say.
And boy, is that an understatement. I finally found my lobster, and it honestly couldn't be a person with a more beautiful heart.
Okay, so here we can see that, yes, she is a little bit now starting to talk about Spencer, but Spencer is her lobster and he has a great heart. But it's almost like she's talking about her favorite doll. I'm sorry. I don't mean to sound so crass, but it sounds like she's talking about her favorite pet almost. I'm sorry. It's so trite. She can summarize Spencer in 2 words, but it takes her 10 minutes of her life story to set up sort of summarizing Spencer in one little tiny lobster image. You know what I mean? And it's cute. She is a cute person. She is definitely a cute person, but she's kind of a little girl, and it's interesting. Apparently she got a master's degree, I think it was, in early childhood education. So, the kind of people that go into education, early childhood education, it's, she's a little more of a girly type of woman, she has a little more of an infantile emotional range, let's say. And so that's important too, because, maybe as a dentist, maybe Spencer is not like he's not like a maxillofacial surgeon or like a periodontist, like a hardcore. He's more maybe just like a neighborhood's, dentist, kind of good bedside manner, that kind of thing. But, a lot of people like Michael McKee, like just hardcore surgeons, they're probably not really compatible with early childhood education people. You know what I mean? So it's just another data point. Maybe in the end, maybe Spencer is more kind of, he's got more of the bedside manner. Maybe he's himself more of a playful, kind of a boyish kind of guy, that maybe he would fit better together with that kind of woman, as opposed to somebody like Michael McKee, who might honestly need a woman who's maybe more like an engineer or like another doctor or something, but not necessarily the early childhood education. Because I think Monique, her comfort zone is being kind of like a child, and I think these are the kind of things that you learn in life. You can't just pick a woman just off the rack. You have to be very careful when you pair up with a woman. You need to have someone who's compatible with your own emotional range, and it seems to me that Michael McKee is a little more dour emotionally, a little more kind of not very verbal, just kind of introverted. He probably doesn't need to be with a woman like that. So I'm already now starting to see that they were not, like, Michael McKee was not the right man for Monique. I can see that now.
I will love you forever, and I'm so lucky to be Mrs. Teppy.
That's cute. It is cute what she's saying, but she does end it by saying, "I'm so lucky to be Mrs. Tepe." It's like, it's all about me again. What I get, I got myself something. It's just, it's nice. It is nice. And there is something to be said. Some people can be narcissistic, but it's harmless. It's like benign narcissism. So maybe her narcissism, like they say, pathological narcissism, malignant narcissism. Maybe she has what you might call benign narcissism, like the difference between like having a melanoma as opposed to just having a mole, just having a mole on your skin, So her narcissism might just be completely harmless, and maybe with the right man, everything is just fine, But, let us not forget that what we are seeing here, if we're honest, we're seeing someone who is emotionally immature and who is a little bit narcissistic herself. And probably, I would wager, I would bet money that her dad probably spoiled her to death and probably loved her to death. So, so that's kind of to me, that's kind of helps me. It helps me understand what was happening when Michael McKee met her and how they bonded and why that might have been a problem. So if I had to wager a guess as to what went wrong between Michael McKee and Monique, okay, Monique Sabatursky at the time, right? What went wrong with between them? Okay, if I had to wager a guess, okay, my guess is that two problems. Michael McKee has a different emotional range, and it would have been better for him, better medicine for Michael McKee, maybe to find a woman who is maybe like an airline pilot or like an air traffic controller or like say maybe an engineer, something like that. That would have been a better match, I think, for Michael McKee. Okay. But the other problem we have here is that I think Monique is kind of adorable. She is kind of adorable. And maybe for some very immature part of Michael McKee, he found something really irresistibly adorable in Monique. Okay. And that would be maybe the fatal flaw. They're not matched emotionally, but then she's so adorable in some way that maybe Michael McKee like latched onto her. Like they say that, you'll never get over your first, if your first love is like true love, you'll never get over it for your entire life. I think that does happen. I think people in my family, I've had people that I've known personally that they've fallen so much in love with somebody that if it doesn't work, they'll never get over it for their whole lives. Okay, so maybe she's so adorable in just the right sweet spot for Michael McKee that maybe he latched onto her with his like the part of his heart that falls in love forever. If there is that part of the heart that falls in love and never falls out of love, maybe he latched onto her because of that adorable part of her that caused him to latch on permanently, so that even after a divorce, he can't get over it. So just a combination, but I don't think she was a good match for him. But nevertheless, she's so adorable, it poisoned Michael McKee for life because now he can't get over it. So that's the first part. The second question here is, what was the catalyst? What went wrong in Michael McKee's life that he was willing to essentially commit suicide? Because, considering where Michael McKee was standing in terms of his status, his professional success, to commit a murder like this and then to end up being, like say in jail waiting trial for murder, essentially his life is over. Okay. So he essentially committed suicide. So what went wrong in Michael McKee's life that would actually be the catalyst to actually drive him to effectively commit suicide? And I know that Michael McKee was, like, say, in the course of dealing with a couple of like malpractice lawsuits. I understand that. Because I have a background. I mean, my parents are both doctors, so a couple of malpractice lawsuits, that's not like a career-shaking issue, really. You have to really establish like a pattern of negligence or a pattern of wrongdoing before you're really in trouble as a doctor. So, and that's why you have malpractice insurance. So, like, I'm not convinced that a couple of malpractice actions is really the catalyst. I think that there had to be some other issues going on. But I think in order to answer this question, I think we have to get past this like shock and surprise, like, oh my God, how could a doctor, how could this educated, intelligent person do something crazy? Well, people do crazy things. There's a reason why Barry Morphew killed his wife. There's a reason why Brian Koberger killed those people. I'm not saying it's a good reason, but I'm saying when people go into that crazy place, when any of us go into a place where we're having an existential crisis. Okay, now granted, for a narcissist, an existential crisis can happen when you just have your gratification levels, taken below what you're used to, right? Or let's say your status levels, your perceived status levels. When you have like an injury to either status or gratification, that could create an existential crisis. For a normal person, it might take much more. But when anybody has an existential crisis, okay, dangerous things can happen. Okay, any responsible psychologist knows that when anybody is having severe depression or severe existential crisis, there's always a risk they could self-harm or harm other people. Okay, that's true of anybody. Okay, so we should not be surprised. I mean, if you see someone doing something stupid and crazy, really, really crazy, the first question is, they're probably having an existential crisis. So the question is, what got them into that existential crisis. Okay. And I do think that, in this category of the overachiever, let's say the overachiever narcissist, the narcissist overachiever, I think we have to look maybe for cases that are similar. I don't think this is similar to Brian Koberger. And I don't even think this is necessarily similar to the Barry Morphew. Okay. If anything, I think this is probably a little more similar to me to, like, say, the Corey Richins, although it'll be kind of hard for me to explain that. But the most similar for me is actually this case from back in 2007. Do you guys remember the diaper wearing astronaut case? Do you remember there was a case of a woman named Novak? She was like an astronaut in 2007, where she put on like a diaper and she put together like a backpack full of all kinds of like torture implements, like a hammer and a BB gun, and she drove all the way to Orlando to go assault and like torture this woman that had been dating her boyfriend. Do you guys remember that? I think her name was Lisa Nowak. I think a lot of people understood that she was an astronaut, so it's bad enough. I mean, any astronaut, being caught doing something that irrational. I mean, driving across the country in a diaper to go attack somebody. I mean, that is so irrational. So I think people understood that she was an astronaut, but I don't think people understood how high level of an astronaut she was. I don't think people understood that. She was actually a member of the crew of the space shuttle. Okay, she was a space shuttle crew member, and she was in charge of operating the robotic arm of the space shuttle. That's a very critical aspect of space shuttle missions. And she was on a mission with one of the Kelly brothers. The Kelly brothers that went into politics, but they were like Navy test pilots, and they were also like space shuttle pilots. So she was actually on a shuttle mission with one of the Kelly brothers. And she was an extremely accomplished astronaut. Okay, people don't realize she went to the Naval Academy, and to get into the Naval Academy, kind of like Michael McKee, she was an excellent athlete. On top of being an excellent student, she was also an athlete. So she was, the combination of like, an athlete plus superstar academics, just off the charts. So she was one of those overachievers who was just constantly getting gratification her whole life, all the way through college, all the way. She got 2 master's degrees at like the Naval Postgraduate School in Monterey, California. And, she was just at the top of naval aviation. She went to the naval, I think she went to test pilot school. So she was on top of going through flight school. I mean, she's just at the top of everything. Just a really, really solid person, just across the board. But, kind of like Michael McKee, she was not really experienced with men and with relationships. And when she was already an astronaut, I mean, already like at the top of her career, and really just kicking butt, just really a very successful person. When she was already an astronaut, she actually got into an illicit affair with another astronaut. Okay. And this is while she was married. Okay. So this woman, super successful. I mean, absolutely, top of the game. I mean, and imagine all the psychological tests you have to go through even to become an astronaut. So she didn't have any obvious personality disorder. But I guess, how do you test for overachiever narcissism? Like, is there a test for that? Nobody knew. I mean, nobody knew she had any issues, but it just came out, when she was already successful and already, a space shuttle crew member. She got into an illicit relationship with another astronaut when they were both married. Both of them were married. And one of them ended up getting a divorce, but this one, Lisa Nowak, she stayed married and kind of tried to manage, being in a marriage and also having this affair. But it started to create these earthquakes in her life that I don't think she was prepared for. Right? She just didn't have the maturity, and so very late in life, it just came out that she actually had issues that nobody ever knew before, because you have to have something kind of unusual happen in your life to maybe sometimes crack the egg and show whether you really have a good egg or a bad egg. You know what I mean? But in this case, she sort of fell in love with this one kind of playboy astronaut. But it turns out this playboy astronaut, he had other girlfriends. Okay. And this girl, Lisa Nowak, she couldn't handle it. And so she just cracked. It was like an existential crisis. Okay. Existential crisis. And it was enough to crack the egg. And I think the same thing happened with Michael McKee, although I don't know that we know yet exactly what really cracked his egg. I don't know if it was just that he was just in love with Monique and never got over her. I think there had to be something more, and I'm suspicious. I don't think it was just having a couple of malpractice actions. I just don't think so. I think, knowing my parents who are doctors and knowing the crises that they've been in, and also hearing about the crises of their colleagues, okay, through the decades and decades, my dad had colleagues. He had one colleague that committed suicide. My mom had another colleague in medicine that he killed his wife and killed himself. I mean, these are all, in the medical world, right? So I'm thinking that Michael McKee, I don't think it was just the malpractice stuff. I don't think so. I'm thinking that maybe he had maybe interpersonal problems, maybe with other doctors, possibly, and maybe we just don't know about that yet. And maybe he was starting to have like a midlife crisis. Just maybe some depression was setting in. Just an accumulation, like an accumulation of like all the stress of being a doctor, all the time of being alone, not finding a good partner, like a good female partner. And maybe he just reached a point where he was just starting to get maybe so depressed that he wasn't able to cope with it. And so he may have been entering into like a little midlife crisis, possibly. So I would be looking for things like that, like not just the malpractice. I would think of maybe he was getting a little burned out from his job. Like his job is very demanding. He was starting to have a little burnout. But I would be looking at maybe possibly some kind of like depression, midlife crisis. And maybe as time goes on, I'd like to know a little more about how he got along with his colleagues. I'd like to know if he got in a fight or had like big differences, maybe with another surgeon in Las Vegas. So that would make more sense to me than something as simple as just a couple of malpractice lawsuits. I don't think that's enough to cause that much of a problem for a doctor like Michael McKee. Combined with the fact that maybe there was something very adorable about Monique that sort of really stuck to that part of his heart that he couldn't maybe get over, so he could never really fall out of love with Monique. And then maybe if we could maybe go back to how they got in a divorce, I'd like to examine a little more like the extent to which they got into like an ego contest, okay? Because my feeling is that I think Monique's narcissism also plays a part in this, okay? So that maybe when you get two egos going after each other, it may have really left Michael McKee with a grudge against Monique, maybe. And maybe if we could kind of go back and explore that. That's why I think this is similar to the Corey Richins. Because when you look at Eric Richins and Corey Richins, I don't think Eric Richins intended it this way, but I think Eric Richins was so competitive as a person. Mormons are very competitive. I'm sorry, I'm just going to say it. Mormons can be very competitive. I just think it's part of the culture. And I think Eric Richins, even for a Mormon, was super competitive. And I think even though he didn't intend it, I think that because Corey also has a big ego too. I think Corey and Eric sort of got into like subconsciously kind of an ego contest, like two egos, And so that's something I'd like to explore with Michael McKee. Like when he was married, he decided, I think very unwisely, but when he did decide to get married to Monique way back, okay, Monique Sabatursky, when they decided to get married, I think that was a very crazy idea because he was going to take this newlywed woman, this needy, her dad spoiled her, kind of a spoiled, needy woman, immature with a lot of emotional needs. And he's going to uproot her, take her away from her family, take her to another state. And she's just going to sit in the house while Michael McKee does a general surgery residency. That sounds insane. That is so much stress. That's going to leave her so isolated. So I think even if he were like the perfect man, I don't think that was a good setup for someone like Monique at that time. So I think that was like dumb. But I think somehow when they actually got to Virginia and they actually tried to start setting up their house and their family, I think it would have been so demanding that general surgery residency. I mean, Michael McKee wouldn't have any free time. He'd be totally absorbed in his job. He wouldn't even have any emotional energy to give to his newlywed wife. So I'm thinking that maybe almost immediately, for Monique being separated from her family, living in another state, having a husband just completely absorbed in a very demanding job, I would think that immediately she would just be, as a spoiled girl, she would be registering a lot of insatisfaction. like really showing her insatisfaction. And I think Michael McKee probably didn't know how to deal with that. Okay, so he probably got very stubborn with her. And if I'm correct in my intuition, I think he has obsessive compulsive personality disorder. And obsessive compulsive personality disorder people, they can be very dry and stubborn, very, very kind of forceful and non-verbally stubborn. And I think he would have come across to Monique as totally insensitive to her emotional needs. Okay. And his attitude might have been, come on, you're an adult. Like, and maybe he wouldn't have had the energy to like engage in the emotional realities of that situation. So I think his very taciturn kind of nonverbal stubbornness might have been perceived as a kind of like abusiveness on the part of, Monique. She may have perceived that as abuse. And also maybe if he lost his temper a couple of times, and maybe said things he shouldn't have said, or if they literally were getting into an ego contest as to the circumstances. From her point of view, this guy's not giving her enough emotional attention, or maybe he's emotionally absent. He's too superficial, too boring. He's not satisfying her. I think his only response would have been for his ego also to get into that contest and say, hey, look, we're two adults. If you can just be patient, Monique, if you can just be patient for a few years, I'll get over this residency and eventually we'll get on track, but can you please just grow up and be patient? You can already see it would be like two egos clashing, right? And so my concern is that if Monique herself had a little bit of a narcissistic issue, she may have gotten so fed up that I can just imagine the scene. Because according to Michael McKee's ex-girlfriend, what happened to Monique was she just took all the furniture and just left the house really aggressively. And maybe Michael McKee just took that as so aggressive and so hostile that it probably really like pressed his buttons, his competitive ego button, where he felt like he kind of had almost like a vendetta against Monique, or still had a grudge, like a that place where he was like in love with her for being so adorable, but at the same time she really wounded him by leaving so aggressively. Maybe he really maintained a kind of I don't know, kind of like a grudge, like a real grudge, where combined with, I don't think the malpractice suits are enough, but like maybe combined with like more of like a whole, like a full scale midlife crisis where he's really getting into like a existential depression, like seriously questioning his whole life and just getting burned out from his job and maybe having problems getting along with other surgeons along the way. Maybe at some point, if you could combine something as serious as like a hardcore midlife crisis with that grudge that he had against Monique, and then maybe if in the course of his depression, if he was stupid enough, Michael McKee, to actually go online, because it's easy to find online, like say the footage of the wedding where Monique's getting married to Spencer, maybe all those things together, he might have just been like, well, fuck you, and I'll just destroy you. Like, I'm going down and you're going down. He still felt that grudge. It may be something just that simple, But if we can learn anything from this case, I don't think the murder itself is so much the interesting part of this, but I do think it has a lot to teach us about this special version of narcissism, which is like the overachiever narcissism, and what that might show us about what narcissism really is. That narcissism isn't just so much about self-esteem and insecurity, but it really does have a lot to do with these gratification issues, like the gratification set point, and also that's the set point that successful people have with their perceived status. And while a guy like Michael McKee might have had a very high status in his job, in his profession, I think he felt that he was really fallen very short. I think he felt that he fell very short in terms of having maybe a romantic life, or maybe having a good wife. And I think maybe in his narcissistic brain that looks for high status, I think he envisioned that he could have possibly had a very good marriage with Monique because she was just the perfect, irresistible, beautiful person for him. But just that, there was poison in that relationship, and in that place where he could imagine almost like the perfect marriage, there was also a terrible contest of egos, that left that horrible combination where in the place where you most expect that you could have, like, say, the best status of a marriage, there was also that terrible rivalry between two egos that can, in the worst situations, lead somebody to actually commit a murder. So anyway, I would like to actually cover this case in more videos. Okay, these are going to be kind of longer videos. I don't expect a lot of people to watch these videos, But I want to learn more from this case. I think this case has a lot to teach us on the psychological side. Okay, so I'm going to be paying a lot of attention to like more information as it comes out about, like, say, more information about Michael McKee's work history, how he got along with other surgeons, other professionals. I'll want to know if he was having some kind of midlife crisis, some kind of a depression, something like that. And so as more information comes out, I really would like to take like a really close look at this case and more like kind of, let's say, more kind of deep dive sort of long form videos. So, I'm not going to be editing these videos too much, and I don't speak that well. I'm not the best speaker, but so this isn't for like a lot of people to watch, but I want to take like a really deep dive into this case psychologically. So as we get more information, going into the future, I'm hoping to like maybe put out like maybe 3 or 4 like hour-long videos, like really going deep, because I think this case has a lot to teach us about narcissism, especially from this special point of view of what I think is a very important form of narcissism, which is overachiever narcissism. And I do encourage anybody, to look into the Lisa Nowak case, because I think it's so similar to this case. And I think if we can just see this case from the right point of view, I think we can get away from these kind of like oversimplified kind of caricatures of Michael McKee. Oh, he's just a monster. Oh, he's just a terrible person. I mean, we need to kind of leave all that aside and just take a neutral, careful look at exactly how Michael McKee got into this situation and exactly kind of the special sorts of problems and crises that can arise for people who are overachievers. Okay, because I think that's a very special category. And when overachievers commit terrible crimes, I think it kind of has a special cocktail of circumstances. And it may take a little time to figure out exactly what all the dominoes were that set up to cause this. But anyway, do appreciate your patience. I do expect to do more videos on this case. And as always, thanks for watching, and I'll talk to you guys later. Thank you.